Now, the threat of long waiting lists still looms over United Kingdom. Latest records show around 7.4 million people in England are waiting to start their treatments. And the NHS bosses are blaming the crisis on staff shortages. The leaders have urged the government to publish the long-awaited workforce plan. NHS chief says that the figures show that the pressure still continues on the already stretched National Health Service. Just in April, the number of people waiting for more than a year rose to more than 370,000. NHS England claims that it is making progress and that the staff are working hard to reduce long waits for elective care. Meanwhile, the government has announced a part of the plan to reduce hospital visits to cut the waiting list. UK Prime Minister Rishi Sunak has announced the launch of 8 new community diagnostic centres. Sunak claims that these centres will quickly diagnose for conditions such as cancer, heart and lung diseases. The Rishi Sunak government has also cited cutting waiting lists of NHS as one of his 5 priorities. And this comes as nurses and junior doctors they are already expected to stage another industrial action. This will be over pay conditions, hiring, after their union members rejected the government pay offer. Now, for more on this, our correspondent Alex Izat is joining us live from London. Welcome to the broadcast, Alex. The number was already at record high back in April. It was a 7.3. In March, 7.3. And now again in April, it has risen to 7.4. Now, experts previously had predicted that there might be a dip mid next year. Now that the number has climbed to 7.4, how are experts reacting to this?
Well, a lot of doctors within the NHS and specialists are saying it's unlikely that it's actually going to go down. We've had a huge problem with waiting lists for quite a long time, specifically before COVID. But when COVID hit, a lot of those departments were short-staffed and weren't allowing people to come for their appointments. So they were trying to push them back. And that's why the waiting list got even longer, and it's still longer still, because many of the staff that were there during COVID, the stress pushed them out of the job and they retired early. So there is likely that we're going to be seeing a lot more people on that waiting list, and it's not likely to come down. The UK itself has an older generation as well when it comes to specifically cancer. Unfortunately, as we get older, that's more likely to occur. And it's great that Rishi Sunak has been pushing that this diagnostics, and potentially that people can go to pharmacies and not have to go to their doctors. But even when it comes to small things like trying to get an appointment, that does seem impossible for many, and therefore getting those referrals, which can take months and in some cases can take years. People have been on those waiting lists for years, and sadly some have lost their lives because they're not getting the treatments that they need. The only thing that really can fix this, and we haven't seen it yet in this 10-year plan that should be coming out, is more staff. But ultimately getting those staff in when there are, as you rightly say, strikes coming and more action that is going to be taken over pay and working conditions, is unlike people aren't really going for the job. It's low pay, it's long hours, and the stress of working in those departments is just too much for a lot of people. So it does really need a huge boost, and it's not just about the money going into it, it's about the hours as well. And a lot of unions are suggesting that that's what needs to change, and that's what needs to be said in this plan going forward.
Right. Now, we are being told that the government has decided to reduce hospital visits to cut the waiting list. Now, is this a preliminary step that could yield results later? Because the demands of a fair pay, proper working conditions by the NHS, these demands have been some sticking issues. So how is this going to help the waiting list?
Well, that would be interesting to see it work out in real time. There are a lot of people that go to A&E and go to the hospital when they're not necessarily needing to go to hospital. Sadly, a lot of people do go for mental health reasons because there isn't anywhere else for them to turn, and it's taking on a lot of pressure on those staff. They're also going for small things like for triage issues, so small cuts and small problems. And that is really what's causing the backlog at many A&Es and emergency emergency services. We saw during the COVID pandemic that a lot of hospitals came out and said, please don't come to A&E unless it is serious and it's a life conditioning, a problem for life-threatening condition. But a lot of people still go. It's just that's what they do. And we're hearing as well for GPs all around the country as well, people just go because they are lonely and they're having these other mental health issues. And that really does need to be a problem that needs to get solved. And that's one of the issues that doesn't seem to really be focused on when we talk about the NHS and we talk about waiting lists and GPs. There is a whole section of society that will continue to go and use these services. And sadly, that means putting a backlog on those people that really do need the service.
All right, Alex, thank you for getting us all those details and updates from London.